Welcome to the CNS Podcast featuring Dr. Daryl Inaba, Research Director for CNS Productions.
I think for all of us in the treatment field, we need to be reminded that people have pain, whether they're not an addict, not an alcoholic, or whether they are. We experience physical, sometimes emotional, but more on the physical standpoint right now. They experience situations in which they have some very painful stimuluses in their life, and that we have an obligation, we have an obligation to make sure people can be relieved from that pain. And an addict who wants to maintain recovery has a fear, tremendous fear, that that's going to stimulate a major relapse. Well, the thing that's important is that there have been many strategies and many medications developed to treat pain effectively while minimizing the chance for a relapse and minimizing the chance for a person to become dependent upon the medications you're using. Right now, I think the protocol that most people use in dealing with chemical dependency or somebody who has a substance use disorder and is also in either long-term or acute pain is to see first if they can be that pain could be relieved by very large doses or healthy doses of non-steroidal anti-inflammatory medications. Ibuprofen and medications like that used at the prescription level, the 600 milligram dose, are often very effective in treating dental pain on an acute basis and even treating some chronic joint, shoulder, and muscular pain. So that's one of the first lines of therapy people use in approaching pain. The second line of therapy is that there are many heat compresses or cold packs that can be used and put right over muscles and joints and sort of act as a counter stimulant or something that alleviates pain in that mechanism. For people with chronic muscular and chronic extremity pain, there is a developing growth in compounding specific creams and specific ointments. There are analgesic gels that have been developed by many pharmacies that are effective in treating locally the pain with anesthetics and keeping it from reaching the brain so it doesn't become a major issue. In development and actually used a lot now in people with both conditions of pain and substance abuse is a growing use of antidepressant drugs that have noradrenergic reuptake inhibiting effect. So you're classically, we understand that these, or we know about these SSRIs, serotonin, specific serotonin reuptake inhibitors. Well, there's a huge host of new age antidepressants that not only inhibit serotonin, but inhibit the reuptake of norepinephrine. And it seems that those medications for depression that block the reuptake of norepinephrine as well have very good analgesic effect. So the effectors and the Cymbaltas and things like that are now being looked at as effective medications for pain to be used in people with substance use disorders. I guess then we're left in the next line that we have somebody with significant pain that is diagnosed. The important thing is there has to be a valid diagnosis for pain. There certainly are a new number of conditions that make that hard to do, but we have to accept that these are conditions that do cause a lot of pain. Fibromyalgia is one of them. It's hard to diagnose fibromyalgia, but we do know it causes a tremendous amount of pain. Plantar fasciitis, you have tic douloureux, you have migraines. They're really hard to in diagnostic process, but people do suffer significant pain and have to be relieved. And if it can't be relieved by the other routes, then we're looked at using the opiates, and we're using opioid type of drugs and things like Ultram and maybe the less addicting Stadol and things like that that are thought to be less addicting, although we find that they are just as addicting. The key to managing somebody who needs that level of pain treatment is to really monitor and manage the medication use in them. The best thing probably to do is if you're teamed up with a substance abuse treatment program like the Genesis program where I work with, we offer that on an outpatient basis. We offer people who are on those or need to be put on medication, say they get an abscessed tooth, need acute relief that nothing else is relieving, and the doctor has to use something like an oxycodone or a hydrocodone. We would provide that service for that patient, can bring their medications to us, and we will then dole them out on a daily basis, on a per dose basis, on a 2-day dose basis, or instead of giving that patient a bottle of 100 of those pills to take as they needed, which becomes a real trigger and a huge stimulus to craving, we would keep the medications for them. They'd come in, it has a chance for intervention, has a chance for even doing groups or doing things if they are in a craving mode, but keeping their medication managed so that they take them for the pain and not take them for the activation of addiction. Physicians themselves should monitor their pain patients. They should have their pain patients sign a contract, and a medication contract, that they will not abuse them. They should make sure they don't succumb to all of the very common, I dropped my pain medications on the bathroom floor, or accidentally lost them or something like that, so that they don't get into heavy overprescribing, and they can monitor the patient taking the proper amount, proper time. Plus, they should always have the patient bring their pain prescriptions with them when they come into their medical examination, so that the doctor can count them out and make sure they're being taken in the right order. There's a number of strategies can be used with this to effectively treat somebody with substance abuse disorder who has a valid need for pain medication, and I think it's important for the addiction treatment community to recognize that we shouldn't be so afraid of this as we have in the past, and we should be more actually involved with patients who have pain and help them control their need or their use of pain medication so that it doesn't precipitate major overuse of pain medications.
That wraps our pod for today. Thanks for visiting the CNS Podcast. Please check back soon for the next in the series and visit our website, www.cnsproductions.com.